Hello, my name is Ryan Harper, and I'm a digital reporter with WNCT. And today I have the pleasure of speaking with Dr. Silvernail. He's one of the most highly regarded doctors in Pitt County. And let me introduce you to him.
Good afternoon, Ryan. Good afternoon, Pitt County.
Good
Pleasure to
afternoon.
be here. Today, Ryan, as a total or over the last 14 days, how
Uh, the last 14 days.
when we look, we're actually coming down, which is good news. So I want to make sure your listeners or your viewers hear that. We are at about 5,600 cases over the past 14 days. So that's come down steadily since last Friday. When I look at this on the week to week, graphic that I get from the state, we actually started coming down the week ending January 15th. And we were down the week ending the 22nd as well. So just got that report this morning. Um, so I'll show you this one, and I think this curve makes a couple of points, Ryan. These are cases by early state of illness that live in congregate living, and congregate living means nursing homes, group homes, things like that. And if you look at this, the blue are folks who don't live in congregate living sessions. The orange or salmon color at the bottom are those that do. And you see back the end of June of 2020, we had a little outbreak in one of those facilities and had some cases there. Through the first summer of COVID 2020, we had some cases and outbreaks came down. We had some activity through the fall. And then the vaccinations began about the middle of December 2020. And so we still had some activity through that. The boosters were given about the second week, beginning the second week in January. And then you see through the rest of 2020 and into 2021, we had almost no cases in there. There are some cases. We've got a few outbreaks now. It's so small in comparison to the curve, it doesn't really show up on the graph here, the way the graph is scaled. But this graph makes a couple of points that with control measures in these institutions, we've been able to limit the spread of the disease in these institutions. And after vaccination, cases fell off and almost vanished in these institutions because the vast majority of residents are vaccinated and a large proportion of the staff are vaccinated. When just to review this with you, like I say, this was an outbreak in a facility in the spring of 2020. We had our wave in the summer of 2020. This was the ECU wave. And then we kind of went level, and then we built through the fall to our January peak in 2021, fell off into the spring of 2021, had a little resurgence in the spring of 2021, and then dropped until the week of June 19th. And that's around the time that Delta really got a foothold. And then we went through the Delta wave, and we were falling off of the Delta wave here through the fall, had a little bit of uptick through the holiday time. And then Omicron came, and this is the Omicron wave. And you can see for the past 2 weeks now, our cases on a week-to-week basis have clearly fallen, and it would appear that we're on the backside of the Omicron wave at this point, although still at very, very high case levels from a week-to-week basis. Mhm. Well, Omicron is very infectious. More infectious than the original strain, more infectious than the Delta strain. Um, some people say it's almost to the point where we would consider it airborne transmission. I don't know if we're there yet, but it is very transmissible. We have seen this kind of erode natural immunity. We've seen it to some extent erode vaccine immunity in terms of people getting the infection. Vaccines still offer protection against hospitalization and death, but everything in COVID is imperfect, Ryan. And so we'd still, if you can be 6 feet away from folks that you don't normally live with, that helps. If you wash your hands frequently, helps. There's not a lot of contact transmission with this. It helps. But I think most importantly, if you can stay home when you're sick and not give this infection to others. Masks may have some limited role, although there are those out there saying that masks don't work for Omicron. There are people encouraging folks to use N95s. N95s are really a respirator meant for short-term usage, not for continuous usage. And that mask, if it doesn't fit you well, isn't going to protect you either. So if you're going to use one, make sure you understand how to use an N95 mask before you just go out and buy one or receive one through some other method. But I think those things are important. Getting your vaccination, getting boosted if you're due for vaccination, due for a booster in your vaccine series can help reduce the risk to you if you do acquire Omicron. And we do think that a very large percentage of the population is going to be infected with Omicron before this is over. Well, Omicron first, the first sample that was positive in Eastern North Carolina was a Pitt County resident. And that was back on December 11th was our first, was the date the sample was collected. We didn't get the results of that sequencing for, I don't know, about a week. I think it was the following week. We actually reported the second, third, and fourth cases in the state the next week. And I think the holidays helped this spread. It is something that is, again, more transmissible than the other variants. Basically, almost being in the same room with someone, you have the potential to be exposed if that person is carrying Omicron. There's also the literature that's come down from our federal partners is that the individual is probably most infectious the 2 days before that individual actually gets sick. And then they're still infectious for several days after they get sick. So we know there's the potential for transmission before that individual knows that they're sick. So it's possible that someone could have went to a holiday celebration not knowing they were carrying Omicron and then given it to family and friends who would in turn pass that on to other individuals. So I think that really is the genesis of the Omicron wave. It happened to arrive here right before the big Christian holidays, Christmas and New Year's, which is kind of everybody's holiday, not just a Christian holiday. But certainly the holiday season provided a venue for the vaccine, for the virus to spread, excuse me. Yeah, there's been a lot of mishmashing of names, and there is some influenza circulating this year. It's been relatively small amounts in the respiratory virus surveillance that's done, actually done here through the hospital and the Brody School of Medicine. So we are seeing some flu cases, flu A cases, which we would typically expect in January or February of the year. While co-infection or being infected with more than one virus is possible, it is uncommon. So it would be rare for a person to have influenza and coronavirus at the same time. Not impossible, but uncommon. Occasionally we'll see kids with more than one virus at once, less common in adults, but it is possible. Mm-hmm. Yeah, as I said earlier, and showing you that week-to-week graph, our numbers on a week-to-week basis have been down the past 2 weeks, Ryan. So I think that's encouraging. They're still at very, very high levels, higher than the peak at the end of 2020, beginning of 2021, higher than the peak of 21 going into 22 here, that December peak. The Delta wave, and then what was probably going to be our peak. So while the numbers are receding, we're still at very, very high levels, and there is still a great deal of virus circulating in our community. Well, our demand for testing has gone down a little bit, so getting a test done should be easier. The federal government is making home tests available for people. You can order those. There's a federal website through which those can be ordered. We also have a small supply of tests we'll be distributing. We'll have a press release out later this week with details on that, Ryan. I think for most folks, the most important thing is if you're sick, stay home. Don't take the chance of exposing friends, family, coworkers to the virus. If you're sick, stay home until you're sure what you have or don't have, or until it's been at least 5 days, and just assume that you've had Omicron. The symptoms of Omicron seem to be more upper respiratory, headache, runny nose, sneezing, some sore throat, some cough, but maybe less of a deeper cough than with the original variant. Some generalized achiness, fatigue, maybe fever and chills. But they definitely seem to be more upper respiratory focused than more of the pneumonia focus that was seen with the earlier variant. So that's a good thing. That's a good thing. Most of the individuals that I know who've had Omicron seem to have had a milder case of it. We've had a number of our employees with it. Might as well say I had it myself the first week after the holidays. I had tested positive on a home test and had what I believe was the Omicron variant, and definitely felt similar but different to the infection I had back in 2020. So if you're sick, stay home is good advice.